Welcome to Acute Care Reporting or ACR Training video. Today we'll be going over the acute care reporting system that is designated by OHA for the reporting of behavioral health clients in acute care hospitals. ACR is designed to facilitate the collection of addictions and mental health treatment data for acute care clients and support all publicly funded behavioral health client entities and facilities in Oregon who serve acute care clients. One thing to note about ACR or acute care reporting is that per Oregon administrative rules, providers must submit the following data within 24 hours of an admission and 24 hours of a discharge, although we would ask that you try and get them in a bit earlier than that. It helps us with case management and reporting back to the DOJ. Users are required to submit diagnosis, admission date or discharge date, commitment date, case number for civil commitments, legal status, Medicaid eligibility, Oregon Medicaid number, patient demographics, or REALD and SOGI, and warm handoffs. From our OHA page, you'll be able to access previous webinars, user guides. You'll be able to request a virtual live training, have access to prior newsletters, the ACR commitment types definitions. This will help when filling out the commitment type in ACR for the civilly committed, as there's many types. You're able to request a facility build and request new users for your facility by clicking the link here. From this page, you're able to access the ACR web portal by clicking the Log into ACR link. From there, you'll be directed to a sign-in page. And then once signed in, you'll be directed to your set home facility page. On this page, you're going to be able to see your active acute care clients and summary information about what their admission dates are. You'll be able to find your active client report. From this report, you're able to actually filter. You're able to filter it down to show only the civilly committed or show all clients. You can sort first name, client ID, date of birth, and everything like that. From here, you can go back to facility summary. To add a new patient, you can do it one of two ways. You'll click either on the left-hand side, the Person Information tab, or at the bottom of this panel here, click the Find Add Client. At first, you do have to make a search of the client's first and last name or first three initials or letters of the first name and last name. From here, if you find the client that matches the client you're currently seeing, you can click the blue hyperlink and it'll take you to their person summary page. If this is not one of your current clients, you'll have a Make Your Client button. This is actually one of my clients. All right, so here on Sunny, we have the Make Your Client button. So your treatment status is always going to be active in treatment. County of residence is the county in which the client resides, where the county of responsibility is the county where that holds the civil commitment for the civilly committed. On this page, we ask that you provide as much information as possible, but only the red asterisks are what's required. If you select Medicaid or OHP from the health insurance drop-down, you will be required to enter the Medicaid ID number. Once you click save, you're directed back to the person summary screen where you now have the option to add a new hospitalization. From here, you can enter in the patient number. You can leave this blank and the system will auto-generate one, or you can enter in whatever convention works best for your facility. Court order number, if you have it for the civilly committed, please provide it, even though it is not required. Status type will always be active. And then we require at least the admission date, but again, for civil commitments, all the information that you can provide, the better. Civil commitment type, you'll have the options of quite a few different options. That's where that other page will come and help in the FAQ guide. From referred from, you'll have the option of employee, other community referral, or court and criminal justice. Those civilly committed individuals are going to be the court and criminal justice referral. Other community referral would be a referral from the ED, another provider, or say a peace officer drops off a client. They don't have a civil commitment. They're just dropping them off for a 72-hour hold. You would put other community referral. We do ask that you provide the living arrangement at the time of admission, as well as if they're presenting any harm to self, others, property, or suicide presentation. On the next page, you'll be required to enter at least one diagnosis code, but the option to add up to 4. For this, you can either start to type the diagnosis code, or you can type in the description. Once you're done with that page, you'll be directed to their treatment summary page. From here, this is where you're able to add a new status or discharge a client. You would add a new status for, say, a hospital hold that comes in. Initially, they're on a hospital hold, but then you find out they're actually needing to be civilly committed, and you have the court order. You would do the add new status, update the commitment type, the commitment date, and the county of the commitment based on the court order. You're able to discharge the client. From here, we only require what's in red asterisk, so discharge date and discharge reason. However, again, all the information you can provide, the better. You'll be required to enter in a diagnosis at the time of discharge as well. And then the next page is completely optional, but from this page, you're able to enter in everywhere that you may have referred the client to, whether it's the state hospital, employee assistance programs, DDS services, or back to the courts. You're able to enter these here. You can enter up to 4 referrals that you may have given to the client. Say you want to add a client that does not currently exist in the system at all. So again, you'll have to first search. You don't find the client here, you'll click the Add Client button. We require everything that's in red asterisks, but if you can provide all the other information, please do, especially the Social Security number, driver's license, or state ID numbers if you have them. This really helps us with case tracking, um, patient verification, and everything like that. So the more information you can provide on these pages, the better. But we do understand sometimes you might not be able to get all this information, especially right at admission. Um, so you can come back later. Right now, we just require what's in red asterisks. If you do not know the patient's zip code, you can enter 5 zeros. Highest grade completed, you're going to enter in numeric digits. So for high school equivalent, you're going to enter in 12. Associates would be 14, bachelor's 16, and so on. So from here you click Save and you're directed to the Real D form. So on this form, this one you'll collect from the patient and you'll be able to fill this out based on how the patient identifies, whether they need interpretive services. For the section on race and ethnicity, you'll have the free text field. And then you'll also have the ability to make different selections if the client identifies as more than one race or ethnicity. If the client identifies as more than one race and ethnicity in section 4, you can put the how they identify in order based on the client's preference by dragging and dropping. If they do not have a primary or do not identify with a primary racial or ethnic identity, just click the checkbox and I'll gray everything out. After this page, you'll be taken back to that initial treatment page where you'll put, again, always active in treatment, county of residence, and the county of responsibility. Their health insurance, and then save. And you're directed back to their person summary. And then from here, you have access to the Add New Hospitalization button. To go back to your home facility, you can either click the Home button on the left-hand side or the blue hyperlink where it shows Home Facilities. To discharge a client, when you first log in, right off the facility summary page, you'll click on the blue hyperlink and it'll take you directly to their treatment episode for you to be able to go in and discharge that client. And that would be all that is required for ACR. Again, the more information you can provide, the better, the more it helps us with tracking, case management, and assisting these individuals, especially those going through the civilly commit process. If you run into any issues or need any help, please contact the Compass support at compass.support@odhsoha.oregon.gov, and we'll get back to you within 3 business days. Um, an easy way to find the OHA page is go ahead and search OHA ACR in the search, and it'll be the second option down. Thank you for watching the video on acute care reporting. If you would like to have a live in-person demo or have more questions, please go to our page and select the request virtual training, and we will work with you to get something set up. Thank you.